Okay, so we've got a pretty small painful corn here. Now this one's over the inside of the heel. So this is over a specific anatomical spot called the medial calcaneal tubercle. So it's where the plantar fascia and a lot of ligaments and muscles attach, and it sticks out. Now, as we age, this area gets a thinning of the fatty pad, so the bony lump actually sticks out and pinches the skin. So that's where we get this callousing over that area. And then in that callousing, we've got this little hard central section, which we call a corn. So we'll go ahead, remove all the overlying callus as usual, and then start to dig into this one. And we're cutting around the areas between the living and the dead tissue to try and remove as much of that corn as we can. I'll try and get this one out all in one piece so I can show it to the camera. But usually these are really quite hard, so you can feel with the scalpel where the living and dead tissue is. You can also see it because the scalpel doesn't want to cut the corn, but it just wants to cut around the living tissue. So we've got to be really, really careful not to cut and cause too much blood with this one or too much pain. So we just dig around. We're using that number 15 blade. That's a single-use disposable Swan Morton blade. So they're really sharp. I'm going to use them once and then throw them out. And then it's a really nice sterile way to cut these out so we don't have to worry about sharpening anything or sterilising anything other than the handles. And so that's what the corn actually looks like. It's really, really hard. It's usually translucent. And so it's really just compressed skin. So these are caused by pressure. So I'll probably smooth this one up, sand it up, and then apply some moisturiser. It's best if we review this one in a couple of weeks' time and then try and extend out the time between treatments.